This is Dr. Britt Borden demonstrating surgical approaches to the spine. I'll discuss approaches to the cervical spine. Most cervical spine surgery is performed anteriorly, meaning from the front. This provides the best access to the disc spaces and the vertebral bodies. Here you can see the nerve roots exiting the spine, represented here, and the vertebral arteries represented by these red lines. This is where the top of the cervical spine connects to the base of the skull. Surgery for disc herniations is performed by incising the front of the disc and removing the disc material. A microscope is then used to look inside of the disc and to remove the posterior portion of the disc, which may be pushing on the nerve roots causing pain or the spinal cord causing weakness. After removal of the disc, a bone graft or prosthesis is placed in the disc space and a titanium plate is fixed to the front of the spine with screws, providing stability and facilitating healing of the bone graft. In surgery for tumors or fractures, one or more of the vertebral bodies may be removed with the adjoining discs and a larger prosthesis placed. This would include placement of a longer plate. Additional instrumentation may be placed posteriorly. Posterior approaches to the cervical spine are performed differently with removal of the lamina represented here. This provides access to the cervical spinal cord. Fixation is performed differently in the cervical spine posteriorly with placement of screws in the lateral masses and placement of a titanium rod connecting them. This is Britt Borden MD demonstrating surgical approaches to the spine. I'll now discuss the thoracic spine. The thoracic spine is usually approached laterally, meaning from the side. This is because the heart sits on the front of the thoracic spine. This involves removing one of the ribs adjacent to the level being operated upon and deflating one of the lungs temporarily. After this, the vertebral bodies and disc space can be accessed. As in the cervical spine, after removal of the disc space or vertebral body, a bone graft or prosthesis is placed to create a fusion, and instrumentation is placed to create stability. The thoracic spine can also be approached posteriorly by removing the lamina represented here. This provides access to the thoracic spinal cord and is useful in tumor surgery. Fixation of the posterior thoracic spine involves the placement of pedicle screws or hooks on the pedicles, lamina, or transverse processes. These are connected with a titanium rod. This is Dr. Britt Borden demonstrating surgical approaches to the spine. I'll now discuss the lumbar spine. The lumbar spine can be approached anteriorly, laterally, or posteriorly. Anterior approaches to the lumbar spine through the abdomen are most commonly performed for the fusion of disc spaces or the implantation of prosthetic discs for the treatment of back pain. In anterior lumbar surgery, the blood vessels on the anterior lumbar spine must be moved laterally to access the disc space. A plate can be fixed to the front of the spine to provide stability. Lateral approaches to the lumbar spine are most commonly performed for tumors or fractures. This provides the largest exposure to the lumbar spine. After removal of the bones or discs, a prosthesis is placed and screws or rods can be placed to provide stability. Posterior approaches to the lumbar spine are performed more commonly than in the cervical or thoracic spine. This is because the spinal cord ends in the upper lumbar spine and the nerve roots continue distally. The nerve roots can be retracted medially to provide access to the disc spaces. This involves removing part or all of the lamina represented here. Fixation in the posterior lumbar spine is provided by pedicle screws and rods. The lumbar spine connects here to the tailbone or sacrum, which in turn connects to the pelvis here. This is Britt Borden MD demonstrating surgical approaches to the spine.